And finally, we're up to the fourth one. If your very first symptom was fainting or lightheadedness, we might be talking about multiple system atrophy. So I don't have a nice picture for this one, but 3 years ago at age 52, let's call her Miss Alice, started having dizziness. 2 years ago, she had to see a urologist for bladder problems. And a year ago, she actually started fainting and diagnosed with Parkinson's disease because of some rigidity or stiffness. Miss Alice goes on to live about 6 to 8 years, but she can't sit up. She has to be in a wheelchair that's reclined because of the extremely low blood pressure going to her head. She has all of her intellect, and in fact, I just had a patient recently who was working all the way up until the very minute he died as a consultant. So just laying down on his computer. So the intellect stays. Treatment for them is supportive only. Levodopa really doesn't help. The main thing that we're trying to do is keep the blood pressure up. Prognosis is poor, average of 6 years after the diagnosis. And most, like I said, are either in a wheelchair or in a recliner or bed because of those severe drops in blood pressure. So here's a handful of famous faces that may have gone through some of this. On the far left is Johnny Cash, who's I've heard had multiple system atrophy. On the bottom right is Dudley Moore, who is well known to have progressive supranuclear palsy, although he doesn't look much like Peppermint Patty. And on the top right is Nietzsche, a German philosopher who we think maybe could have had frontotemporal dementia. So after that somewhat sad talk, I hope nobody fits any of those. But again, please don't label yourself as a bluebird until somebody has actually identified you. And for those of my patients sitting in the room, I know you want an update. This was 2 days ago when our street flooded, and this is my 20-month-old sitting in a nice puddle. Thank you very much.